So my name is Ben Gardenier and my presentation is on autism. I'll be talking about proper ways to accompany students with autism in a health and physical education setting. First off, what is autism? Autism or autism spectrum disorder refers to a broad range of conditions characterized by challenges with social skills, repetitive behaviors, speech, and nonverbal communication. Spectrum condition. So this is a term that means every child with ADS is different. The severity of ADS can vary between child, and some cases can be more severe than others. There is no single cause for autism. Generally, the cause for autism is abnormal brain structure or function. There's a theory that's developed that autism-related disabilities has a genetic basis, basically meaning that if autism runs in your family, there's a greater chance that if you had another child, that baby could have autism. This is not proven, but it is a theory. Autism affects 1 out of every 59 children in the U.S. That's a major increase over the last 20 years. Back in 2000, those numbers were 1 out of every 150, and in 2012, they were 1 out of 69 children. So, like I said, the numbers have gone up now that it's 1 out of 59. And there's no cure as of now. However, autistic behaviors can change over time, meaning as the child ages, autism could not be as severe as it once was, as they had when they were a child. Here's some signs and symptoms of what to look for a child who might have autism. Lack or delay in spoken language, repetitive use of language and or motor mannerisms, using their hands while talking, spinning their arms and wrists around, using their fingers, moving them really fast. Also, little or no eye contact. They usually do not like looking you in the eye and tend to look above or away from you. Lack of interest in peer relationships, lack of spontaneous or make-believe play, and lastly, persistent fixation on parts of objects, such as wheels of cars, bells on toys, things like that. There's two different types of diagnoses when dealing with diagnosing autism. The first is a medical diagnosis that's made by a physician based on an assessment of symptoms and diagnosis tests. A brief observation does not solely diagnose autism. There's multiple factors that are involved, such as history of the child, as well as input from parents and teachers that help make the diagnosis. And the second is educational determination. This diagnosis is made by a group of teachers, and they determine if the child who's showing signs and symptoms of autism should be in special education and should have an IEP or not. This team makes the decision, and they basically determine if the child qualifies for special ed. If so, his needs are written down in an IEP, and he's given exceptions and extra needs when learning. Autism can be diagnosed as early as 18 to 24 months. However, it's normally between 24 months to 6 years old. There's multiple treatment options. There's no single treatment plan for autism. Every person with autism is treated specifically to their needs. Understanding strength and weakness of a child is very important, and that helps with the treatment plan. And making best decisions for each specific child is very important. Like I said, no child is exactly alike when it comes to autism. They're all different subtypes. So making the decision that best suits that child's subtype of autism is important. There's some barriers to physical activity in students with ADS. For example, children with ADS are more likely to struggle with obesity and inactivity, and that's due to a couple reasons. The first one is sensory stimulation. Being in a big environment with lots of people, loud noises, big gym that echoes, that can trigger some emotion and some anxiety with children with autism. Social anxiety can be a reason being involved in a team, developing relationships that can cause anxiety, and also just having delayed motor skills can cause anxiety as well. People with autism might have trouble running, hopping, jumping, skipping, and that can just cause lack of interest in physical activity. There are some benefits to physical activity for students with ADS. For example, cognitive performance, behavioral problems, attention span, social behaviors, and learning are all benefited due to physical activity with a child who has ASD. Now I'll be talking about teaching autism students in physical education, and there's some facts to know and some helpful hints that can be used while dealing with children who have autism. First, it's setting up the environment. So, children with ADS struggle in understanding the environment. Because of this, it is important to establish an environment that utilizes students' strengths. Um, Also, understanding the physical layout. Um, the children should know where to go all the time with um, directions, signs, arrows, so they know the structure of where to go throughout the gym class. And areas when skills are performed should be clearly marked. So, for example, with this sign that I have here with basketball skills, it teaches the skill at that station, and they know what to do by looking at the picture, and they don't feel overwhelmed because they're able to learn from themselves on what to do. Creating boundaries is also a big deal and helps to know where they're allowed to be and where they're not allowed to be. And next, establishing a routine is important too. A consistent routine should be followed every time they enter and leave the gym, and it just helps the anxiety not be as great because they know what's coming. Having a clear ending to the class is big too. Making sure uh, the child knows that they can do activities such as like stretching, breathing exercises, yoga. That usually calms the child down and lets them be able to transition from PE to another class. Using schedule and visual cues um, is important too. Uh, for example, creating individual schedules with lists of activities as well as pictures of activities is a great way for children with ADS to follow along in class. Also, allowing them to check off the activity they did on their little notepad allows them to feel one that they accomplished the activity, and two, they know how much more they have to do, and there's some structure and order to that. So now we'll be talking about communication. So understanding the best way to communicate with your particular student is very important. Some children with ADS are able to communicate regularly and it's not as bad. Other people they really don't talk that much and they tend to use sign language or pictures to communicate. So knowing which where your student lies in between that is important, and then using their strengths is important as well. Some children are like I said, are able to speak, others are not. And also knowing your individual strengths of students is essential. Get the students' attention is important. Sometimes it's just really important for them to be able to look at you when you give your directions and make sure that they're paying attention. Make sure there's no possible distractions in the area, and also using bright colors when demonstrating activities, such as certain materials, maybe a red bat or yellow helmet or something like that will help them follow along. Also, taping your arms or legs with bright colors and demonstrating will also help them be more pay more attention to your activity. Simply simplify verbal directions is big too, such as cues as now it's Tommy's turn or watch me can be very helpful. And just being clear and not getting frustrated when they don't understand what you mean the first time, and just having the patience to really repeat yourselves and maybe possibly use pictures or sign language or other things for them to understand if they're not understanding through your words. Minimize physical education lingo is big too. Sometimes they don't pick up on the whole phrases that sports teams use or that you would commonly say, and it would just confuse them and frustrate them. So just stay away from any of that. Um, Using alternative forms of communication, like I mentioned before, pictures, real objects, sign language, they're all great ways to communicate. Now we'll be talking about how to deal with behavior. Um, Preventing challenging behaviors. So ADS children can exhibit challenging behaviors such as whining, running away, making loud noises, crying, laughing, even self-abuse sometimes. Using positive reinforcement is important, making sure that they're doing the behavior that you asked, and then giving them something as simple as a high five, a way to go, a penny or a sticker can really help them change their behavior. Focus and reinforce appropriate behaviors. So, find out what motivates the individual. It could be something as simple as a high five, like I said, and just reinforce that and just get to know your student. So the next one would be teach appropriate use of equipment. So make sure students know the purpose and the use of the equipment. Some children tend to get overwhelmed with all the equipment and they don't know the proper way to use it and they can hurt themselves and they're not learning the proper skills. So just explain it with pictures, have demonstrations, and that should help them understand when to use the equipment and how to use it properly. Dealing with sensory sensitivity is important as well. Just control the gym environment. Make sure it's not too loud. Make sure that other students are behaving themselves and not contributing to any problems that would relate to trouble with your other student with ADS. And dealing with challenging behavior. Uh, there's going to be difficult days when it comes with dealing with teaching kids with ADS. It's just part of the plan. Just make sure that they are following their behavior plan that was created for their IEP. Some other ways you can use quiet places for them to calm down, maybe a long walk with a teacher's assistant or something like that to help them take their mind off what they're frustrated about and allow them to calm down, reset themselves, and then come back when they're ready. Inclusive physical education is very important too. This just means all children, children with disabilities as well, are accepted and should be educated properly. It is a requirement that all students, including autism students, receive the same type of physical education. There should be no discrimination due to the disability, and they should receive the same type of education. Um, Inclusive physical education can be achieved with positive attitudes. Like I said, you're going to have some tough days. It's going to be tough to combine non-disability kids as well with your disability kids, but just have a positive attitude about it, and that goes a long way. Individualized instructions such as just spending a lot of time individually speaking to them and also letting them have a variety of different equipments will help. And targeting age appropriate motor skills is important as well. Make sure they're doing what other kids are doing at the same age and developing social interaction skills. In conclusion, autism diagnosis in children has been increasing over the years. Like I said, although there is no cure for ADS as of now, there are different treatment options available. ADS is different for everyone who's diagnosed with it. Verbal cues, communicating is really big. Signs, pictures also help. And ADS students benefit from physical activity, including students, including all ADS students in physical education is a requirement and a privilege. So that's the end of my presentation. Thank you for listening, and thank you.